Sup YouTube, I'm just going into this video with no script, no practice, no rehearsing. I just assembled a bit of an article with some research and some AI, and I don't know, I just want to talk about a few things. So this is what it's like to be blacklisted by the healthcare system, at least in Canada. And it's scary for most people, not for me because nothing scares me, but I'm just gonna walk you through some information I put together, and this information you can find anywhere. It's just not talked about. We'll see the day that changes, probably, but I'm gonna make sure that doesn't happen. So, the psychiatric hospital industry has faced significant scrutiny over the years due to numerous reports of unethical practices, including insurance fraud, patient mistreatment, and systemic abuse. These issues have raised concerns about the prioritization of profits over patient care and the violation of human rights within these institutions. Insurance fraud and patient mistreatment. Several psychiatric hospital chains have been implicated in fraudulent activities aimed at maximizing insurance reimbursements. For instance, Acadia Healthcare agreed to pay $19.9 million to settle claims of Medicare fraud resulting from patient mistreatment. Similarly, Universal Health Services settled a $127 million fraud case involving allegations of billing for medically unnecessary inpatient behavioral health services and failing to provide adequate care. Whistleblowers have reported that some facilities encourage staff to exaggerate or falsify patient records to justify extended hospital stays, thereby increasing insurance payouts. These practices not only defraud insurance programs but also subject patients to unnecessary and potentially harmful treatments. Involuntary commitments and abuse. Reports have emerged of psychiatric hospitals unlawfully committing patients to maximize insurance payments. A lawsuit against the Psychiatric Institute of Washington alleges that patients were involuntarily held without medical necessity, denied legal access, and subjectified to falsified medical records. Such actions violate patients' rights and can lead to severe psychological trauma. Furthermore, investigations have uncovered instances of physical, emotional, and sexual abuse within psychiatric facilities. Acadia Healthcare has faced multiple lawsuits alleging abuse, including a case where a facility was shut down following revelations of sexual abuse. The phenomenon of gangstalking. No, that's not it. Well, yeah, I'll talk about that. Some individuals report experiencing gang stalking, a term used to describe a situation where a person believes they are being targeted by a coordinated group aiming to harass and intimidate them. Now, we'll get back to this and how the hospital does it, but let me just say this piece. While the psychiatric community often views these experiences as symptoms of mental illness, the stress and impact on those who report them are real and significant. Studies have shown that victims of stalking, whether by individuals or perceived groups, can suffer from psychological distress and lasting psychiatric morbidity. Now, say what you want about gang stalking. I'm still talking about the hospital right now, or the healthcare system in general. Call for reform. The recurring issues within the psychiatric hospital industry highlight the need for comprehensive reforms to protect patients' rights and ensure ethical practices. This includes stricter oversight, transparent reporting mechanisms, and accountability for institutions that prioritize profits over patient well being. As awareness grows, it's crucial for society to advocate for changes that uphold the dignity and rights of individuals receiving mental health care. Now, this is what it's like to be blacklisted by the healthcare system, according to this article I put together. Psychiatric hospitals and behavioral health facilities have been reportedly accused, both in official lawsuits and in hundreds of patient testimonies, of using control tactics that mirror what many refer to as gang stalking. Though rarely called that in official documents, many practices within institutional psychiatry eerily resemble organized psychological harassment, especially against patients who question authority, seek to document abuse, or refuse to comply with forced treatment. Some hospitals pressure patients or their families into signing forms, sometimes non-disclosure agreements, under duress, often upon intake or before discharge. These documents can include clauses that waive the patient's right to legal action, broad confidentiality statements that go beyond medical privacy, forbidding public discussion of what the patient experienced, implied consequences for breaking silence, including involuntary recommitment or legal retaliation. These forms serve to silence whistleblowers and create fear-based compliance, especially when patients are told they are paranoid for objecting. Blacklisting and medical defamation. Once labeled as non-compliant, delusional, or dangerous, a patient can be blacklisted within medical systems. Hospitals often share internal notes with vague but damaging character judgments across networks. This includes, Sherry, I'm so congested. Why did you open the fucking window? This includes labeling someone as having delusional persecution ideation where they report staff abuse or surveillance, flagging the patient in centralized databases which can affect access to housing, employment, or other health care, using electronic health records to insert damaging notes under mental health codes. This creates a paper trail that undermines the patient's credibility, making their complaints about abuse easier to dismiss. Psychological manipulation and staff collusion. Whistleblowers from institutions like UHS and Acadia Healthcare have described staff teaming up to intimidate certain patients. This includes gaslighting techniques, denying things the patients heard or saw, or telling them, you imagine that. Coordinated isolation. Nurses and techs refusing to speak to or acknowledge a patient except when administering medication. Character assassination. Telling other patients or even family or other members of the clique that the individual is a danger, unstable, or a liar to sow doubt. This mirrors gang stalking by turning others against the patient, isolating them socially, and escalating their distress. Surveillance and dehumanization. Some psychiatric institutions install cameras even in private spaces within legal gray zones, with patients reporting being watched while changing, showering, or using the bathroom, feeling as though their phone calls and visits are monitored or discouraged. Medical staff laughing at or mocking patients off record. While surveillance is often justified for safety, its overuse becomes a tool of humiliation and control. Many patients describe feeling hunted, stripped of dignity, and constantly evaluated by people with unchecked power. Institutional gaslighting as systematic abuse. What people call gang stalking inside these hospitals is often institutional gaslighting, a coordinated effort to make the target doubt their perception of reality. The patient knows something is wrong, but every complaint is dismissed as further proof of illness. This cycle. Oh, I lost my place. This cycle destroys a patient's sense of autonomy, enables unchecked abuse behind locked doors, makes future whistleblowing almost impossible as every attempt to speak out is framed as just another delusion. Conclusion: a system designed for silence. While the term gang stalking is controversial and often dismissed as a delusion, this documented behaviors in psychiatric institutions clearly match the patterns: coordinated psychological harassment, false labeling, and reputational sabotage. If you help expose this message or truth, you're helping expose a system that has thrived for too long in the shadows. Now, just to switch things up for you, I'm gonna spit a couple songs that I wrote about my experiences with the healthcare system in Canada. I'm a rapper. I go by Vampire Werewolf. My fiance raps with me. She's very good. She's better than me. Yes, she is. I'm gonna do the song that started the whole beef. It didn't start the beef. They were beefing with me since I was literally 20 years old. And I just went there because I was suicidal, and they're like, "This guy's fucked." It's like, well, I'm in a mental hospital. Maybe you should be a little more understanding. But that's the doctor or nurse for you. I'm just gonna spit this song for you. It's called "Snakes," produced by Netu. It's a live performance. I'll get down so you can hear the beat. Let's talk about a few people on here, not just the hospital, but people who gang stop. Go ahead, call my girl and stuff. You know, you know, you know, it's just big bug. Fucking man, touch the sound, so from the place, doctors and nurses, they were down, we shut shit down. With a gang, you know, it's that big, but storm, every day, like Wednesday, like Spanish, shit deep, it was just well, Rookie, you fucking pissed me off. It was popping off at the motherfucking jaw. Tell me I'm a disgrace. Tell me I'm living in sin. Tell me you're fucking truly tough things with this talk shit with that way. It says that one fucking lady making jokes about you can suck a fucking dick with the camera on, but you never had a ball. And I don't give a fuck what child feelings got to say. Or pack those trying to get him away. I'm fixing this money anyway. And my public trustee won't be able to take. So let me get a woman mic for once and like you what, dice you what, fuck you what, cause the mic's enough. Cause the mic's enough for me, for me. Oh, I thought it was the next part or something. Oh, yeah. Makes you so sick at heart that you can't take part. You can't even passively take part. Look how miserable I am. All these nurses picking on me. Yeah. And now we're beefing. You see that? You see that beef? So I'm blacklisted by them. And they're not all that nice to me. And it's all because I went there at 20 years old and I was suicidal. And I was off a couple meds and I was, mouthing off. But I didn't say anything that bad to anyone. I was just picking on people who were picking on me. That's what most people do in that situation. It's kind of the human thing to do. The human thing to do is forgive, but most people just talk shit back. And I'm a rapper, so don't fuck with me. Period. That's what it's like to be blacklisted by the healthcare system in Canada. I don't know how it is in the States. They probably just shoot you, but yeah. Peace, y'all. I'm posting this on my YouTube and SoundCloud. Come get mad.